Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Hopefully we are all in good conditions. Before starting these discussions, first I want to ask something. Have you ever heard of compassion fatigue? Sound unfamiliar, right? What about burnout? I think it is more familiar than compassion fatigue. Both were similar but it's not the same. In these discussions, we are going to explain to you the part of mental disorder, such as the definitions, the symptoms, and lastly, the treatments. On these occasions, our group will describe compassion fatigue. Before that, allow us to introduce ourselves first. Our psychology group consists of 6 people.
First, my name is Sukna Rahma Umaya.
My name is Tanya Janur Rahman.
My name is Sunada Tawasari.
My name is Wijayanti Kinasih.
My name is Wisnu Adiseptyo Utomo.
And my name is Dion Febrito Wijaya.
We are first semester psychology student at 11 Maret University, but we are very excited to discuss this topic. In discussing this topic, we use reliable sources and we find them in the articles, journals, and other sources. From the sources, we try to summarize and take important things to discuss. Starting these discussions, it is known that compassion fatigue is a mental disorder. Compassion fatigue is a serious problem that can undermine a person's mental and psychical health and negatively affect their relationships and ability to care for others. Now, to find out more about compassion fatigue, we want to explain it to you about the definition, the signs and symptoms, and last, the treatments.
First of all, we are going to talk about the definition of compassion fatigue. Compassion fatigue is a term that describes the physical, emotional, and psychological impact of helping others, often through experiences of stress or trauma. Compassion fatigue is stress resulting from exposure to a traumatized individual. Compassion fatigue is often mistaken for burnout, which is a cumulative sense of fatigue or dissatisfaction. While burnout is one part of this form of fatigue, the term compassion fatigue encompasses a more specific experience, which may be brought about by a stressful workplace, lack of resources, or excessive hours.
As the definition previously mentioned, there are also several definitions of compassion fatigue depending on what source we use. If we look at the Oxford Dictionary, compassion means a strong feeling of sympathy for people who are suffering and a desire to help them, while fatigue is a feeling of being extremely tired, usually because of hard work or exercise. From each definition, we can conclude that compassion fatigue is a feeling of being exhausted because of a strong feeling of sympathy for other people's suffering. Crow in 2016 said that compassion fatigue can also be defined as emotional, moral, and physical distress which occurs as a consequence of caring and bearing witness to the suffering of others. Then how does compassion fatigue could exist and bother someone's mental health? Everyone whose work is nursing, caring, or treating people could be exposed to this compassion fatigue. Why? The reason is because usually their job requires them to be sympathetic to their patients in order to give treatment or justify the emotion of the patient. When one person couldn't make a clear line between work and his or her life, then it could lead to compassion fatigue. When a person is exposed to compassion fatigue, he or she is going to feel other people's suffering as their own suffering.
So next we're going to talk about the signs and symptoms. But before we're going to explain what the signs or symptoms of compassion fatigue. I'm going to tell you what is this definition of sign or symptom in general. So sign or symptom is any feeling of illness or physical or mental change that is caused by a particular disease. There are some signs that can lead to compassion fatigue, both psychologically or physically perceived. Feeling exhausted, helpless, irritable is some of the signs that can be perceived psychologically. There's also physical symptoms like sleep and appetite. How compassion fatigue can affect our daily activities. Compassion fatigue can affect a person's daily life wherever the person is. Becoming pessimistic is one of the symptoms of compassion fatigue that can affect daily activities. It means a person will always have negative thoughts about everything, which is very bad. A person can also have insomnia and exhaustion. If a person has insomnia every day, of course it will affect the sleep cycle and it may lead to
Moreover, we have to identify the signs or symptoms of compassion fatigue. Many people think that compassion fatigue is similar to burnout. People said a compassion fatigue is defined as a feeling resulting in experiencing an event that includes work-related stress. According to research works about factors causing stress in nurses, the factors can be caused by feeling the responsibility for deadly ill, relationship with management, condition related to the work environment, role conflict with healthy members, lack of social support, and increased density of patient. And not only recognize the sign, but we also have to know the and here are some signs you have to look out. First is feeling exhausted physically and psychologically. Second is feeling helpless, hopeless, or powerless. Third is feeling irritable, angry, sad, or numb. And fourth is blaming yourself and having thought of not having done enough to help the people who are suffering. And last but not least is physical symptoms. There are sleep and appetite disturbance, nausea, and dizziness. Not only recognize the sign, but also we have to know the treatments of compassion fatigue. Helping others without replenishing yourself can be overwhelming and can lead to compassion fatigue. It might sound cliche, but you need to put your own mess first before you help the others. We need to make sure we are tending to our own emotional and physical well-being and needs while we are involved in providing care for others.
Next, we're going to talk about the treatment of compassion fatigue patient. The right treatment for compassion fatigue depends on your individual experience. Some common treatment include self-care and professional care. One way of treating compassion fatigue is by taking care of yourself. One of the simplest ways to take care of yourself is to take the time to practice home remedies. But if you feel that the self-care you're doing is not enough, you can visit a more professional person to get more adequate treatment. You can tell everything to a psychologist, psychiatrist, or other professional to get the right treatment. And the last, there's how to prevent compassion fatigue. For first, we have work setting for prevent compassion fatigue. How a therapist perceives their working condition is linked to their degree of depersonalization and emotional exhaustion. Overly hierarchical working environments with more significant caseloads, policies, and paperwork can be damaging. Second way to prevent compassion fatigue is a client. Therapists should consider the long-term impact of working with a high volume of clients, particularly those who have experienced suicidal tendencies, child abuse, and suffered depression. Next, we also have personal trauma and grief. Therapists should ensure that they do not use such setting to work through experience from their own past, which could result in a loss of objectivity, over-identification with clients, and depression. And for last, there's a separation of personal life and personal role. Therapist personal and family problems can surface during session, influencing treatment and their expectation of the client.
So in conclusion, compassion fatigue is the emotional, moral, and physical distress which occurs as a consequence of caring and bearing witness to the suffering of others. The symptoms of this compassion fatigue is feeling exhausted, helpless, hopeless, angry, and many more. A person who suffers from compassion fatigue will always have negative thoughts about something. After knowing that compassion fatigue can disturb our mental health and our daily activities, we must know how to prevent it and what is the right treatment for compassion fatigue. Compassion fatigue can be prevented by separating personal life and professional roles. If someone has suffered from compassion fatigue, they should go to get professional help from such as doctors, psychiatrists, or psychologists. As we said earlier, compassion fatigue and burnout are often mistaken by being considered as the same thing. There are similarities, but they are not the same. While burnout is defined as a cumulative sense of fatigue or dissatisfaction, the term compassion fatigue encompasses a more specific experience, which may be brought about by a stressful workplace, lack of resources, or excessive hours. So after listening to our explanation about compassion fatigue, such as the definition, symptoms, how it affects our daily activities, the treatment, and also how to prevent it, we hope that each one of you knows how the importance of mental health in our life, and we should raise awareness about it. Because a mental disorder like compassion fatigue can ruin our life.
All right. So after listening to our explanations about mental disorder, namely compassion fatigue, we find out the compassion fatigue is a term that describes the physical, emotional, and psychological impact of helping others. Now, we can recognize the signs and symptoms of compassion fatigue. Know what we do to prevent and the treatments for compassion fatigue. That's all for our discussions about compassion fatigue. We hope that our discussion can increase our knowledge about mental disorder, especially compassion fatigue. We sincerely apologize if there were any mistakes. Thank you so much for your time and attention. Wassalamualaikum warahmatullahi wabarakatuh.